just so thankful to have the legislators here to help discuss telehealth in South Carolina, and so we've got some questions here for you. And what we're going to do is I'm going to first get y'all to just introduce yourself to everybody instead of me reading your bios. I think it'll be more interesting if you just tell a little bit about yourself. So we want to start.
Okay. Good morning, everybody. My name is Jeff Bradley. I have the privilege of representing District 123, which is Hilton Head, Daufuskie Island, and Levy. So y'all are in my district, and I'd like to welcome all of you here and thank you. I hope you had a good time. Mr. Herb Kurzman organized the weather for you. How did he do? Can we get a little hand for that? I do several things. I'm on the Education Committee. I'm co-chair with Shannon Erickson for the Education Committee. I am the chair of the Regulations Committee and chair of the newly created AI, Artificial Intelligence, Cybersecurity, and Cybercrime Committee. So that's the work that I do, generally speaking.
Good morning. My name is Celeste Davis, and I'm a member of the South Carolina House of Representatives. I represent District 100, which is in Berkeley County. I currently am the chair of the 3M committee, and that's Medical Affairs, Military Affairs, and Municipal Affairs. And have, as a lot of you know, I'm very proud of my children. I have 2 children. One is in the Army.
Right.
And one is hopefully graduating from USC.
Yeah.
That's great. Good morning, everyone. Mark Smith, it's been a delight to be here with you over the past 2 days. Thank you for having us here today. I have the great opportunity to represent House District 99 in Berkeley County, which is basically Daniel Island and Hanahan municipalities. So thank you for having us here. I get the opportunity to serve underneath Madam Chair here, my boss lady, that I affectionately refer to her as often, on the 3M committee, and I chair the medical subcommittee, and I also sit on the House Oversight Committee as well. Thank you for having us.
Well, good morning. My name is Dion Tedder. I am a state senator representing District 42, which covers Charleston and Dorchester counties. I was recently in the House representing North Charleston area only. I serve on the Medical Affairs Committee, Judiciary, Fish, Game, and Forestry, and Penology and Corrections Committee. And so happy and delighted to be here. And as I serve on the Medical Affairs Committee, this is a very important topic that I anticipate we will continue discussing in years to come.
Good morning. My name's Tom Davis. I'm the state senator for District 46, which is all of southern Beaufort County, Hilton Head, Bluffton, Sun City, Hilton Head, and the portion of Jasper County that Sun City encroaches into. So that's my district. I'm chairman of the Senate Labor, Commerce, and Industry Committee. And then more pertinent to the discussion today, I'm chairman of the Medical Affairs Subcommittee regarding scope of practice, and we also handle telemedicine. So look forward to a good conversation with you all.
Hello, everyone. Bill Herb Kurzman, District 118 here in Beaufort County, and welcome to our very humble area. We're glad y'all are here. I do pick up the slack for Beaufort County, as you can tell. And right now I chair the Health and Human Service Subcommittee for Ways and Means, and have just been intimately involved with telehealth from day one. So I'm so glad to have you here, but so glad that we have telehealth.
Thank you. And thank each of you. We really appreciate you coming. We know y'all have a very busy schedule, and we just appreciate y'all taking time out of your schedule to come. So the whole reason we have you here is to ask you some questions and to get some input. So the way we're going to do this is I'm going to specifically ask each of you a question, and then after that person answers, if somebody else wants to add something to that, then you're welcome to speak up. The first question is for Senator Tom Davis.
Okay.
Senator Davis, given the increasing focus on integrating artificial intelligence in healthcare, how do you see AI technologies influencing the future of telehealth in South Carolina, and what legislative measures should be considered to ensure that AI is used ethically and effectively in this space?
Okay, and I'm going to refer to some notes here. I think there are 5 principal areas where AI can be very valuable in terms of providing healthcare services to patients. The first is under the category of virtual assistants. I mean, a 24/7 virtual assistant that can answer common questions from people about medical conditions. I mean, just very baseline information, so that there's an ability for a patient to, at any time of the day, any time of the night, to come in and have certain basic questions answered. So I think in terms of virtual assistants is one area. Second of all, in regard to patient monitoring, patients wearing devices and sensors and managing chronic conditions, having the ability to determine whether or not there's anything abnormal, anything that's out of the ordinary, anything the patient needs to be aware of. I think there's an opportunity for that sort of remote monitoring. Image analysis, when a patient has an X-ray or a CAT scan or an MRI, I think having the ability of artificial intelligence to look at those images and to draw preliminary conclusions in regard to what those images show, I think is very valuable. In terms of triage, when patients come in and need care, having the ability to prioritize and figure out which patients have the most immediate needs, I think that results in a more efficient use of time by healthcare providers. And then finally, in regard to treatment plans, once you have, genetic conditions, established, once you have, certain, medical conditions have been verified, I think that there is a role that AI can play in looking at that data and then coordinating a treatment plan. Now, those are all very valuable things, and the trick is, and this, in my law practice, we confront the same thing. There are certain basic inquiries that can be answered through artificial intelligence. The trick is, when you have something out of the ordinary, when you have something that isn't the norm, how do you have a trigger sent to where that person needs individualized care and a physician or a nurse practitioner to provide that one-on-one service? So the challenge is going to be identifying the exceptions to the rule. And in regard to legislative actions, and this is true across the board when it comes to medical affairs, we need to be very humble about what we don't know and listen to the medical community to tell us how we can implement this. I mean, I'm an attorney, okay? I've got no particular skill set that can be applied to this area, but I can listen and I can understand and I can learn. And so in terms of legislative response, I rely very heavily in the committee that I chair in medical affairs to professional testimony, to you tell me what current practices are, what's worked in other states, what hasn't worked in other states, physicians and healthcare professionals informing me, and then we follow the lead of what that tells us.
I think that's good, Senator Davis. I think, this is sort of it's a new, the AI is certainly new, and there's going to be a lot of dark players that we have to watch out for.
It's always the exceptions to the rule you're concerned
Right.
about, because any new technology can be useful, but can also be abused by bad actors. I mean, so
Exactly.
you're going to need to have those guardrails put in.
Anyone else?
I might add a little bit on the AI side. You folks in this room would probably be very interested to know that there are 7 or 8 areas of specificity that we intend on targeting in the state of South Carolina relative to the use of AI and what we might attempt to fund and that sort of stuff. And healthcare is certainly one of them, one of the major ones, along with logistics and advanced manufacturing and aerospace and education. So that's a big deal. We're also looking at you said bad actors in AI. One of the things that we're looking at is criminality more so than trying to regulate the use of AI at this point. We're going to let it, I'm going to propose that we allow it to develop over time a little bit before we jump in and try and regulate it too much. So.
But sitting on the cybersecurity, you certainly have a
Yeah,
interest
well,
in that. Yeah.
that's a whole different,
different.
that's an entirely different matter. We need to, we have a shortage of people in cybersecurity. We're working with the tech schools and the universities to pump up their programs. We need something like 10,000 people that we're shy of for cybersecurity right now. So.
Can I make one further point about AI before we move on?
Yeah.
I think in this space especially, it's important that we not try to micromanage legislatively, that we give broad authority to the Board of Medical Examiners, broad authority to the agencies that can respond more quickly. I mean, it doesn't make any sense that as you move, as Jeff says, as AI is used and as problems arise and as best practices are developed, it doesn't make sense for y'all to have to come back to the legislature each time to amend the code. So we can establish some broad parameters in regard to what best practices are. But then I think if we delegate it down to the agencies, I think you can have adjustments made in a more timely way, in a way that benefits South Carolinians more than if we try to legislate it, on a micro level.
I know you're not trying to make this an AI conference, but specifically to your point, Tom, been all over the country, and a lot of states are attempting to regulate, and legislate and control AI. We in South Carolina are getting a brand name for what you just described that we intend to allow AI to develop, and we're not trying to clamp down on it. So actually, we're perceived as out there in the front of the nation with this AI stuff.
Thank you, thank you. All right, the next question is for Chairman Davis.
The other Chairman Davis.
Oh, yes, Celeste Davis, sorry.
The prettier one.
You're right.
There you go, yeah.
Representative Celeste Davis. As South Carolina continues to expand broadband access, particularly in rural areas, what can be done to ensure that these infrastructure improvements translate into real healthcare outcomes? Are there any specific programs or incentives that the legislature could introduce to accelerate telehealth adoption in these regions?
And thank you for that question. I see a number of us have our notes up here, and these are all of my notes here. So I don't know exactly how useful they're going to be, but all that being said is that, and I think the notes show that what we're dealing with has a lot of opportunities. And, we've got plans to spend a lot of money to support this technology. And I think that trying to figure out what the outcomes are going to be is a very, very important thing that we need to be considering. And I think what we have to do is look at short-term outcomes and long-term outcomes. I think for the long term, we're hoping to improve access to health care, improve health care benefits to folks. I think we're trying to lower the cost of health care. I think that's what we would all hope that we're going to do with this. But in the short term, I think some of the things we can measure are going to be looking at specific points and specific data. For example, the number of births, because we are going to focus on OBGYN services in our rural areas. The number of births, number of healthy babies, number of healthy moms. Those kind of very specific ways of measuring how our costs are paying off and the benefits that we'll see. I think, for the short term, those are the kind of things that we're going to keep looking at with an eye towards what we're going to see in the future. I think there's a lot of different ways we can cut all the data to try to figure out how well that works for us. But in the end, I think that all of us are busy doing something associated with telehealth. And I think that the outcomes in some manner will become apparent. And I think we're already starting to see that. And I'm not sure how much of that is going to be measurable, objectively measurable.
Any other thoughts on that?
Says it all.
One other thing I will add is that a lot of times we're trying to measure what doesn't happen. And it's very hard to measure what doesn't happen. And so to that extent, I think there again that we have to measure what we can and then go from there.
Do you think there are incentives or programs that the legislature could adopt that would help to accelerate the telehealth programs?
Well, I mean, one of the most obvious issues is having physicians and having healthcare workers available to do the work, right? We have shortages of doctors right now, and I think something that we could do legislatively is help to provide some sort of incentives for those doctors and those healthcare people to move into those rural areas and serve that area of South Carolina.
role position, I agree. The next question is for Senator Dion Tedder. Senator Tedder, telehealth has proven to be a valuable tool for addressing healthcare inequities, particularly in underserved communities. What new initiatives or policies are being discussed to address the ongoing challenge of healthcare disparities, particularly for racial minorities and rural populations of South Carolina?
Yeah. So to expand on, because this kind of segues from what Representative Davis just talked about as far as expanding with the shortage of providers. So what we've done, we have the Telehealth Modernization Act, and what that allowed is for out-of-state providers, for South Carolina to allow out-of-state providers to give telehealth medicine without being registered in the state. And that really just expanded that access to people because of that shortage of providers. But specifically, that's one of the things that we've done legislatively. As far as the rural areas and certain marginalized communities, obviously access is a big deal, particularly with the rural areas, because when you think about physically going to the doctor's office, you have the people that don't have transportation to get there, but then also the time to go to the doctor's office and then sit and wait. And so really this has just kind of streamlined a lot of things to expand telehealth medicine. But also when we look at these communities, particularly in the rural areas and minority areas, we've been talking a lot about mental health access and mental health expansion through telehealth, because it's it's easier, and really COVID sort of opened this up to this idea that we can practice, we can do professional practices online. As an attorney, we didn't think that we would be able to go to court outside of a courtroom, and during COVID, we were all on WebEx or Zoom doing plea deals and actually having court hearings in the judicial system. And so that has kind of opened the door for how we can streamline and expand that, but particularly with those areas, we have to be intentional about educating people on just technology in general, getting our elderly people up to date with how to use the technology. And so we need to focus, when we look at telehealth expansion, not just about provider, but just the educational aspect in these rural areas, these marginalized communities, on just technology, education on how to use it, and providing access when we go back to broadband and expanding that. So that was a big deal that we'll see it continue to push, because you can have it in place, but if people don't have access to it, they don't have internet or broadband, then that defeats the purpose. And so I think we're moving forward, but the telehealth, the Modernization Act, I think was very beneficial in closing that gap with the lack of providers by allowing out-of-state providers to take part in South Carolina in telehealth.
Thank you. Any other thoughts? Did you have-
Oh yeah, so looking back at my notes again, some ideas that we could probably do. So I jotted this down. So we can plan for what's called reimbursement parity, right? And so this is just an idea, because one of the advantages of telehealth is reducing plan costs by reimbursing the the telehealth providers at a lower rate. So that's something that I anticipate will continue to be talked about as well. But those are just ideas on how to streamline it, but also reduce the cost when we talk about access for everybody, particularly in these marginalized and lower income communities in the rural areas. So I did just want to throw that out there as well, that's something that I plan to push forward.
And PCC has been very proactive with digital literacy, really. That's been a big push of ours to really get that out into the rural communities all over South Carolina. And we have more initiatives going forward for that. Any other thoughts on that?
I'll jump in if you don't mind.
I don't mind. And
Yeah, go right ahead.
I do, go ahead and say
Yeah,
something now.
A follow-up to Dion's comment about accessibility. The broadband issue is huge, and we're getting there. I've been involved in it since the beginning of us rolling far reaches of areas, but we still have small communities that are not having dependable access to the internet. So broadband is going to have to remain something that we all stay focused on, the quality of the broadband, and I'd like to thank our partners with that, because really, truly, we've had all hands on deck. If you've got some kind of cable or you got some kind of easement, you have helped us with that in the state of South Carolina. And I think the good news was that it wasn't top of Dion's list to say, the first thing we gotta do is get broadband out there, because we're getting it there. But having a meeting with a doctor on broadband needs to be a good, strong, steady stream. And we've got to make sure that we've got that, because you can't have the call being dropped or the internet going out. So those are things that we're still working on. And I think that's important for us in the state to realize that we have areas that still don't have good pole wires and underground feeds. So I think we need to continue with that.
Thank you. This is Representative Shannon Erickson, and thank you for joining us. And everybody else sort of introduced themselves, so I'm going to give you a minute now to introduce yourself.
Thank you. I'm sorry that I'm late. I literally was stopped behind a huge traffic accident on 170 and 21, which is an artery for me to be able to leave the community and come this way. So I had 25 minutes in traffic or an hour around, so I waited the 25 minutes. I serve House District 124, which is Beaufort, northern Beaufort County. We're the non-glitz and glam. You're in the fancy side of the county. We're more of the authentic antebellum, with all the Spanish moss trees and the beautiful homes, and a little bit slower pace, if you will. I serve as a chairman of House Education and Public Works. Before that, I was the Ways and Means chairman for Transportation and Regulatory, which is how I worked so much on the broadband issue. So, but education and broadband, you can imagine that's pretty hand in glove as well. So, but I've been in the House for 17 years, and honored to be here with this group. And thank you. I remember when we rolled telemedicine out before COVID, Dion. Actually, we were ahead of the game. South Carolina didn't say that very often, and we don't, and we were, and we've really grown this. It's important for our state, and quite honestly, we showed the nation how it could be done, and I think we helped a lot of people along during COVID, where they could say, oh, well, little old South Carolina can pull it off, we can too. So
Yeah.
thank y'all for
I
having
agree.
me.
Thank you. Well, Representative Erickson, you got here at the right time, because it's your turn for your question.
Time is up.
Yeah. With the ongoing integration of telehealth services in schools, how can the state legislature further support this trend, especially in ensuring that school-based telehealth programs include mental health services for students? And what barriers still exist in implementing these services, and how can they be overcome?
I love the question, because with education in South Carolina, we're constantly moving, constantly improving. The first piece is going to be, we've still got schools that are going to fall into that category that I just mentioned of not having that good, strong internet service. So we've got to make sure that exists everywhere. We have rural schools that still need that. So we need to make sure that gets taken care of. And the other piece is going to be not so much a state piece as it is educationally throughout our districts. The state can support it. I think more of the choices on which communities need, especially that mental health piece, is going to probably be pushed down in decision-making for local districts. I know our Beaufort County district has made those calls for themselves. It has a telemedicine system. Every community is different, and the districts themselves need to fine-tune what it is they're looking for. We also have a little bit of a twitch that we need to really pay attention to, and I don't know if anybody here paid attention, but we asked the districts to also come up with their classroom cell phone free zones, and we pushed those down to the district levels. So I think that this is almost the same type of thing. We want to make sure that our children, our students are safe when they're accessing these things, and that parents have the ability to have approval and know what's going on with these, especially health situations that they need to give permissions to. So the local folks, our districts, are going to be where I think provide those and how they do it, but not so much micromanaging each district, because you guys all come from someplace different. I bet you could give me 46 county scenarios of how your district would want to see it done. And too many times, Superintendent Weaver and I have talked about this a lot. Representative Bradley sits on the committee. We know that local districts need to make a lot of these decisions. So we give them a goal, if you will, and then guidelines, and then ask them to implement what comes there. But do we need more mental health access? Absolutely, across the board.
Yeah.
So could that be a component? Yes, and I believe it is in Beaufort County strongly. But it's got to be more local level decision and parental involvement on what those students are accessing when they're in the school environment. It's a plus, but it's also a liability that we take very seriously, and as I know you as well do. So I think we've got to walk down that road and make sure that we've got partnerships all the way along the line to make it happen well.
Okay. Any other thoughts on that?
I would just add to that, thank you for that, Shannon. One of the things that we often hear is, from a small percentage of people, is the concern of big government and I'll take care of my child and you leave my child alone. And you said in your comments, and I think we'd be remiss if we didn't just kind of come back and accentuate and underline that, it is, parents are in total control of their children. They have the ability to opt out. And I don't think from us hearing those concerns, which are legitimate from those folks, but for the small towns like I grew up in Bamberg, in a single mom household, the youngest of 3 boys, having that ability to go to the doctor and not have my mom have to miss work to take me to the doctor for those follow-ups. Sometimes those children go without care because mom can't miss work or dad can't miss work.
Yeah.
And so it's critically important that we hear the whole story and not have knee-jerk reactions in some of our decision-making as it comes to allowing this to happen. So thank you for your steadfast focus on that.
I think that was a very good
That
point.
was a good point.
All right, the next question is for Representative Jeff Bradley. Representative Bradley, as the state works to utilize federal funding like the Broadband Equity, Access, and Development, also known as BEAD, program to enhance broadband access, what additional steps can the General Assembly take to support digital literacy initiatives, ensuring that South Carolinians have the skills necessary to benefit from telehealth and other online services?
Well, I'm not so sure the question should be asked that way. I think I suggest that maybe we should ask it, what are we doing, not what can we do? We actually have a lot of things going on right now. We're pushing digital literacy through the K through 12 process. And for instance, we are in the process of designing right now a 9th through 12th grade curriculum for the use of AI. That is a kind of a hot topic, and we're trying to figure out exactly how to teach young people to use AI ethically. That's a real issue. I don't think there's anybody in this room that would have written a paper in high school without using AI if it was available to you. So we know these kids are going to use AI, so we're going to agree to allow them to do it. We're just going to teach them how to do it ethically and to report what they're doing. So that's one thing that's being driven through the K through 12. I'm on a commission called the Southern Regional Education Board AI and Education Commission, which Governor McMaster is the chair of. And that is trying to address the way the digital learning world is changing, because teaching has to evolve. And we're crafting policies on how the K through 12 and post-secondary education system can use AI in the expression of learning. And one portion of that is how we have individualized learning plans. Now, I'm talking about our children at this point, not the adults. We're in partnership across the state with a number of agencies, with the flagship universities, with the technical colleges. We are in early stages of negotiations with both the Palmetto College and South Carolina Educational TV to deliver literacy and AI experiences, because I'm concerned that our adult population can be left behind in a world that's post-AI. And we need to teach people how to use AI and to not be intimidated by it. So that's maybe a subset of adult literacy, but we're in partnership with the Palmetto College is crafting an education program that they will be delivering to the entire state through their platform of online learning, which includes remote locations. And I also think that rural libraries are actually a great spot for the delivery of some of this, where people can go to the library, which is not too far from their location, and pick up on some of that. And we have to continue to focus on education, public awareness for this sort of stuff. So we're actually all over this right now. So.
I agree 100%. I think I need digital literacy on AI because I think it's gonna, the ones of us who didn't grow up with computers and we've had to learn the computers and now to learn AI, I mean, I know my children are much better at anything digital than I
Right.
am.
Oh, no question about that. But on Senator Davis's point relative to the delivery of preliminary legal advice or the preliminary delivery of health care through an avatar kind of situation, a bot, if you will, we are working on a project right now where we are creating an avatar, and I think we're going to actually make the avatar Representative Herb Kurzman. So, you can check into the Department of Administration's website and find an avatar that will be able to be your personal assistance through answering any question about the delivery of services for the state of South Carolina. We expect to be rolling that out in January, and that's just a pilot process. I'll tell you something else we're doing. We're in partnership with Google, and I know this is a little off topic of digital, but it's in my realm of regulations. On Wednesday, 2 weeks ago, we republished a digital compilation of all the regulations in South Carolina. We're taking that digital information and we're giving it to Google. Google is using it as a large language model. They're applying an algorithm on top of it, and we intend to be able to use that large language model of our regulations to find all the duplicative regulations, all the outdated regulations, all the regulations that conflict with each other. So that is kind of a use case that we're applying. Those are actually 2 use cases that we're applying right now. We believe that the use of AI across state agencies will be able to allow our full-time employee count to remain flat as the demand for government services increases across the state as the state population grows. So that delta between our FTE and the demand for services is where we believe between $1 million and $2 million worth of savings can be found in each agency across the state, and we have 70 some odd agencies, 69 or 70 agencies. So we think that that's a tremendous savings for the state long term. So we want everybody to be on board with the AI literacy and the digital literacy.
Any other thoughts on that?
I would just add that you disclosed your need for AI literacy and digital literacy as well. I'm sure I'm not the only one up here. I often need iPhone literacy, and I'm just thankful that my 3 sons, they will help me navigate the challenges of that. So I think we're all going to be, hopefully, in that constant learning stage as we go through all of this, because there's a lot to learn.
I agree.
But hold on, toward that end, can I just see a show of hands? How many of you have used ChatGPT in here? Okay, I mean, then you're literate in AI. It's no more complicated than that. Try Copilot sometime with Microsoft. That's pretty good too. So there's.
I'll have to try that.
It's easy. But it's all in the prompt.
Our next question is for Representative Herb Kurtzman.
Yes.
All right, so Chairman Herb Kurtzman, with advancements in telemedicine technology, there is growing need to update regulatory frameworks. How can South Carolina modernize telehealth regulations to support the use of remote monitoring, virtual care, and cross-state telehealth services while ensuring patient safety and privacy?
Now, let me first off say that Lisa said I'd get an easy question, but so much for that. Well, yeah, that's right. Yeah, last year I told just a little story about how telehealth began, and I'll bring this home, but let me just say it again. When we first tried telehealth, Mark, I think all of us will remember in here, the first year there was a room full of people completely against it, 100% against it. The second year there's a half a room full, and the third year there was 4 people in the room, and I think they got lost on the way to the break room. Right, Jeff? Didn't you? Yeah. Okay. So, and I say that because the first year we heard about everything that could go wrong. I mean, it was just amazing at how many, and this is from, some of the people with good intentions, some of the primary care docs, some of the insurance companies, some of the hospital folks, everything that could possibly go wrong, whether it be feasible or not, was brought out in that. And I think that's what we're talking about right now. It's been honed down a little bit. The second year is, kind of a shorter list, and now we're on a list of, I think, maybe more, it has more to do with the privacy, but it also has to do with being able to share the information. I mean, for example, during COVID, can you imagine, we all read about the deficiency in vitamin D, how that affected COVID patients. Can you imagine that being shared, with telehealth, and not names or anything, no HIPAA violations, but having that being shared. But at the same time, you may have to, you don't want someone mining the data on that. You may have a certain area that's deficient, has a big deficiency and a high mortality rate, and if it was to be able to be mined by the life insurance companies, it would be counterproductive to the people that we're trying to serve, I think. Having said that, I think the ability to mine that and have that data in there without HIPAA violations on there is going to be tremendous. But what we do have to watch out is the data mining and the dark side on that. So, without going into too much regulations, which, by the way, the people that are doing telehealth right now are doing a fabulous job of self-regulating and that. And like Tom and Jeff said, I think we're going to have to rely on the people who are doing the telehealth to tell us what regulations they need, because the worst thing we can do is over-regulate something that we're really excelling in. We have to have the regulations, the guardrails, as Tom says, for the folks who are actually participating in this. But we don't want to stymie it. We don't want to stop this, the improvements we've made and the amount of progress we've made. And this progress, again, has been in 4 or 5 years that we've made. And can you imagine not having telehealth during COVID? Look, who's laughing now, right? So, yeah. I think it's incumbent upon us, probably as the legislature, to hear what's going on and to let the self-regulation go, and then maybe codify that self-regulation.
Let me add this to Bill's point. There are really essentially 2 types of law out there. There's statutory law, where the legislature acts, and then a subset of that is where we empower agencies to do regulations. But then you also have something called the common law, okay? And there are standards of practice that physicians and healthcare providers have now in regard to providing care to patients. And so when we talk about the legislature being modest and sitting back and letting the telemedicine market sort itself out, that doesn't mean we're being derelict. The common law will attach itself and will determine what best practices are. And there's a very well-established set of common law relative to a physician or a healthcare professional providing care to a patient. So allowing that on a case-by-case basis to be adjudicated in the trial court level develops a body of case law and common law that then governs what the industry does. So when we talk about the legislature not overreacting and stepping in and over-regulating, it doesn't mean we're just simply being passive, because we have another set of laws out there that helps regulate this space. And so I think that's the point, and Bill makes it well. Let that sort itself out in the real world, and let trial judges listen what best practices are, and then developing through that a set of common law that will guide behavior in the future.
If I could jump in, I'm gonna echo both of these guys and say the problem, and Tom's right, the common it just flat out raises costs, and there's no way around it. And the whole idea here is to lower costs and raise accessibility, right? So if you let the system work, no, we're not being derelict, we're letting the system work. Our regulation only puts impediments in the way of the folks who are offering services. If common law brings us a problem that we see that is over and over and over repetitive, that's a different scenario. But most often regulations get in the way, make you have to spend money and jump through a hoop, and it normally isn't about what's a good outcome for your patient. And so I would say these guys are right on the money by not having the money be pushed instead of the patient need being pushed.
And just to add one little thing to that, also there are times where when we jump the gun and then later on we're having to do an emergency, push something through to change, to change the regulation because we acted too soon. And as Bradley said, this is going to keep evolving and expanding. We're going to continue learning about it, so we can't be too quick to regulate something and now we have to go back and undo it because it hinders something in your practice. And so that's also where you all come in and telling us, because you're the ones that are actually in the space, you telling us, hey, this is what we need, this is what's working, this is what's not working, here's what we anticipate. And that's how we can come up with some legislation that's meaningful and not just us jumping out there and doing things that we'll have to come back and revert later.
Yeah, I think we're going to see that too. I mean, there's no one in telehealth right now that I know that's going to overstep the scope of it and risk malpractice. I mean, I think we're seeing a growing industry, and I think we know what the bounds are, or they know what the bounds are, and we're just there. We're supposed to be here just to help them create those bounds.
Thank you. Good conversation there. The next question is for Representative Mark Smith. Representative Smith, as telehealth continues to grow, there's a risk of fragmentation among providers and services. How can the state encourage better coordination between healthcare providers, insurers, and telehealth platforms to ensure a seamless and integrated care experience for patients?
Well, first of all, I think I need to say that we've all acknowledged we're not where we want to be, but we're certainly not where we were just a short few years ago. Representative Chrisman, when you and Representative Erickson were talking, all I could think about was the pioneer, renegade, mavericks, early adopters that the two of you truly represent. So I guess we can capture that in a song, y'all were country when country wasn't cool, I guess. So thank you, and Jeff, and many others who truly, for the newer elected officials, and Senator Davis as well, in the upper chamber side, from the lower chamber, we want to make sure we always give homage and reference to the upper chamber. So thank you, Senators, for what you do as well. But, because nothing happens without all of us coming together at the end of the day, as has been said. But truly not being where we were, I think that the best answer to that question earlier is refer to page 3 on your program and look at the 915 program. Telehealth's role within South Carolina systems. Those of us who sat through that segment of the program saw the collaboration happening between what truly could be defined as competitors, right? Competing against each other in some overlapping market share places. But that's not what we saw. We saw the coming together, the sharing of, the openly sharing of successes. How about that Black River success story? It just was incredible. 25 beds, and if I heard correctly, 16 to 17 census on a daily basis. Y'all, that's significant. How about Well, at the end, and who's the number 2 sponsor on the bill? Y'all, at the end of the day, it takes the majority of votes to get anything passed on either chamber. So it's gotta be collaborative. We have to think in the plural sense and get out of the me, mine, I's. And we heard that through our institutions. In fact, I want to pull out another comment that was said, redefining telehealth. Because telehealth is not the second-rate option. Just because I choose to live in Bamberg County and my hospital closed and I'm able to come to your practice and I get to participate in telehealth opportunities doesn't mean that it's a second-rate service, because I'm getting what? We heard those successes. I'm getting all of those services from the big institutions that are multifaceted and multi-service lines that are able to be offered in my little nook and cranny of the state in South Carolina, and I'm benefiting from that. The other piece of it that I thought was really important that we need to make sure in these rural areas, certainly getting the broadband there, layering on top of that the teleservices, but also the educational element. Change does not come easy for any of us, most of the time. So here I got grandma, right, in Bamberg, and I got my parents in Santee, and I'm talking to them about, hey, y'all log into this iPad, and it's gonna be incredible and fantastic. They're like, I'm not touching that thing. I'm gonna go to the doctor. So I think we educate folks in the way, meet them where they are. Maybe it's through their church groups, maybe it's an elder in that community who's a key influencer in that community. There isn't just one ad fits all component as part of that advocating and educational element. It's multifaceted, it's all of the above, and continuing to utilize also those grassroots efforts as well. So how do we continue to learn from that? I think we're well on that way, and we owe a huge debt of gratitude to our institutions who sat here earlier and were collaborative in nature. And then we have these wonderful organizations like the Alliance, like CPC, that's bringing all that together and providing those services that are taking us to new heights. So I think we stay the course and we continue to do everything that we can. And most importantly, we listen to each of you. We have the votes, but you folks have all the knowledge that we need to hear during those committee hearings and testimonies. When we ask you to show up and you've been called to come, please know how much we each appreciate that. We need that and we want that. And we thank you for doing that.
I will say, I think that is one, I like what you said about all the systems working together, and I think that PCC has really made sure that we've included all areas of the state and all the major systems as partners, so that it can be one collaboration and not working against one
No
another.
one's threatened or intimidated by the other.
Exactly. So, any other thoughts on that?
You know, what Mark said was I work with families and children. I have child care centers. We partner with hospital, but I also have 5 grandchildren. To talk about what is normal now, and what we've done with the telehealth scenario is give parents peace of mind at 11 o'clock at night. You've given them the opportunity to reach out and say, my child has a spiking fever, I'm a new mom, and I don't know what to do, and somebody will listen. And that is not second-rate care.
That's right.
That is primary care at its best. And I'll get emotional about it. I don't get the phone calls from parents anymore saying, Miss Shannon, what do I do? You guys are. You're getting the, my child has a spiked fever, or, you know, I can't stop them from the stomach flu. What do I need to do? And so having access like that, you're helping parents, you're helping families who are taking care of elderly folks in their families. Because how many of y'all believe that a health crisis is always at a convenient time? I mean, never in my experience is it going to happen when you've just got loads and loads of free time. very next day, and getting their family taken care of or themselves taken care of when they most need it. So I think we have seen, in a very short period of time, it go from being, quite frankly, Bill's right, was suspect when we first stuck our necks out. Everybody had thoughts of, oh, what are you gonna do? I mean, truly, it was. And now it's become, what an incredible gift we have that we can have healthcare at those inconvenient times and to support families. I think that we will see, like AI and our broadband, it's something that gives us more of a quality of life. And isn't that what we all want to have in our state and our nation?
Yeah, and also it just encourages, I mean, outside of just the care for children, but really just convenience. I think it encourages more people, more adults to seek medical care via the virtual telehealth, because a lot of times we use excuses. I do it all the time of, you having constant migraines, or a person that's having some symptoms, and you just, well, I'm gonna take some Advil, I'll be okay, because you have the time, you don't want to make the time to call and set an appointment, wait for it to be scheduled, and then go sit in the doctor's office because you're busy, you have things to do. And so this just takes away those excuses, but also allows people who otherwise would not have ever gone to get checked out for something that could be more serious than what they anticipated, just having that quick call online and saying, here are my symptoms, and is the doctor to check it off, or they'll say, okay, well, this is more serious, you need to go do this, let's set you up with this, or a prescription. But I think it just encourages more people to actually go seek healthcare, because a lot of adults, particularly men, we do it where it's like, oh, I'll be okay, and then, down the line, something that we could have caught earlier on is more serious because we just didn't take the time or didn't have the time to go through the traditional steps. And so that's another aspect of it as well, just preventative care. Even when you talk about mental health for pregnant women and postpartum, that access to that is real. And so this is just all encompassing, I believe. And so look forward to see the continual expansion of telehealth.
We've got a few minutes left, so I want to open it up for questions. So if you have a question, raise your hand, we'll bring you the mic.
Ask Bill.
Yeah.
Bob Bank, Department of Mental Health. I have a question about your thoughts on insurance parity. One of the things that we've run into is we're in 600 schools around the state with our counselors. We often reach those particular students for the psychiatric aspect of their care by telephone. And a lot of the private insurance companies don't want to recognize the school as a place of service. So, a legitimate place of service. So I just use that as one example where we run into problems with parity. Now, psychiatric care often is at the lower end of the totem pole than equity anyway. But just interested in your thoughts about those issues.
I'll be glad to start out. In mental health for telehealth and telehealth in general, it's got to be outcome-based. I mean, the parity should be there. And as we all know, everyone in this room knows, parity is fought daily. That's a battleground that we're all fighting daily with some of the insurance companies. And I mean, everyone in here has seen the denials, just the standard denials. We're dealing with some things here in the Low Country on that right now. But the parity has got to be based on the outcome and based on the treatment. And you can't say that a doctor giving up half an hour in telepsychiatry is worth less than a doctor giving up half an hour in real time. So that's my personal opinion on it, and that's what we're working for.
Yeah, I would just add to that. First of all, thank you and your entire department and team for what y'all have done for our children across this state. It is nothing to take lightly and deserves a significant appreciation.
Have another question?
Quick comment of the
I would just add to that, thank you for that, Bill. I think he was getting to where that appointment happens, and just, I would echo Representative Herb Kirschman. As long as that outcome and that patient is being treated, that can happen on a Zoom call, on a telehealth visit, or an in-person facility as well. So definitely needs to be addressed and looked at. And I think the way we do that is just like we did with CON. We bring all stakeholders to the table. We have some difficult conversations. And when everybody hurts a little bit, we got ourselves a good bill.
I'd jump in on that a little bit. And I don't know, I would have to get a little bit in the weeds with you, but sometimes on insurance carriers, for a parent or the custodial guardian, whoever, to assign care at that location might be a nuance that we could work on with the insurance companies, that maybe they're not used to taking that type of a scenario where they're not in the home, but the parent needs to give permission. The parent gives permission that it's at this site, and then maybe that's your foot in the door. I don't know, but I'm definitely willing to look into that, and I'll bet you that you got other people up here too who can look at the nuance of how we get there. I worked on BabyNet many, many years ago, and we found ways to get those services paid for simply by having parents assign the ability to have them done in different places like child care centers or schools. So maybe it's something that simple, but let's take a look at it and see if we can't have a process that moves a little faster for you within
Yeah,
them.
I think one of those aspects we're going to have to look at too is the uninsured, because that's a whole different dynamic when you're talking about parity. I mean, it's something that we're going to have to deal with. We're going to have to weed our way through that.
One of the things that's fortunate from the standpoint of uninsured, so many of our children do have Medicaid. That's
Right.
been helpful. On the adult side, unfortunately, we only have about maybe 35% of our seriously mentally ill adults covered by Medicaid. So it's
That's
even
right.
a bigger problem there.
Right.
I think we have another question over here.
Yes, hello. My name is Victoria. I am from the South Carolina Telehealth Alliance, and although broadband connections have continued to increase over time, thanks to the work of many broadband advocates, there's still a lot of residents of South Carolina who do not have a broadband connection, even in areas where it's physically available, the fiber is laid. And that's largely due to the increasing cost of broadband. So my question is, as we continue to work to build that infrastructure so that it's available, what legislative action is being taken to make broadband more affordable?
I'll say this in regard to, I don't think it's going to take legislative action. We've assigned that to the ORS. ORS is in charge of taking the funds that we allocate and making sure these dark spots are covered, making sure that it's efficient, making sure it's affordable. So I think it's really a budgetary matter and making sure that ORS has the resources it needs to accomplish that objective. I mean, a lot of money has come down after COVID and various stimulus packages. Dollars came down to the states, and so a lot of funds have been expended by ORS. It may be that if those grant monies from the federal government aren't sufficient, we may have to deal with that in the state budget to appropriate funds. But it won't take legislation per se, but it will take maybe providing resources to the ORS.
We have another question. Oh, we have Kathy.
So let's give our legislative panel a round of applause. They traveled, some of them traveled a pretty good distance to get here, and they have been committed to attending our summit every year and giving us their thoughts on telehealth and broadband. And we appreciate everything that you've done. And I think it was said earlier, I've been to meetings with other states, and they're like, how in the world did South Carolina progress so much with telehealth? And how in the world did you get your legislature to put funding into that? So we're very proud of that, and we're very proud that we get to work in an industry where we can actually help people and truly increase access to care. So thank y'all for that. We appreciate it. So we